Well, welcome back. Let's talk of some medicine, some healthcare. Regenerative medicine is what we're talking about this morning. Dr. David Ikudai is joining us. It was great to have him join us. Last time was here. Some groundbreaking moves going on in Nigeria's healthcare sector, and delightfully, I'm happy to reintroduce him here once more. Tell us exactly what's been happening in the period he's been here. I'm sure a lot of Nigerians beginning to understand what regenerative medicine has to offer to them for a number of illnesses and ailments that have defied rather oftentimes terminal in nature and oftentimes giving less hope to people. So what we're going to do now is have the discussion with Dr. Kudai. Thank you very much for joining us on the show.
Thank you for having me.
All right. So tell us what's new, what's going on.
Yes, a lot of Nigerians are already benefiting from regenerative medicine. I mean, this has been going on in Nigeria now for a couple of years. I know people are probably aware of this by now, that there was a sickle cell transplant that was done about 5 years ago in a 7-year-old child at University of Benin, and the patient is still alive, successful. And some doctors in Nigeria are already coming to US, to learn about this, but they're still having challenges in starting up because of the cost that is involved. But that being said, at the center where I work in Nigeria, for the last 2 years, a couple of patients have been treated. We have patients that were placed on kidney transplant by major hospitals. They found out about regenerative medicine. They decided not to go for kidney transplant because they have to be on medication for the rest of their life, because that means it's another person's organ, so they have to take medication to suppress rejection. And the medication is pretty expensive. So these patients, some of them could be because of diabetics, that they end up having chronic kidney problem that led to the need for kidney transplant. In Nigeria, there are patients who have been treated with adult adipose or fat-derived stem cells, and these patients are currently off dialysis, off diabetic medication. Their hemoglobin A1C, which is what we doctors use to monitor the sugar every 3 months, is like 4.3, less than 5. There's one of them, after about 4 or 5 months, had restoration of vision in one eye. Weakness, everything has gone. And there's another, patient who have kind of a double dose of the treatment, and this patient, has been able to read newspaper without glasses. Even
how old are these patients?
And some of them are between the range of 52 to 60. That's even for their there are patients that like 79 years old who are either wheelchair bound, but are not able to climb down, walk, climb on examination bed by themselves. I mean, regenerative medicine is tomorrow's medicine available today. There's still a lot of things that we are learning. So it's an ongoing study, but it has been proven to be safe. That's why it's been able to be used. Well, to just make it clear for those that understand stem cells, what I'm talking about is adult stem cell therapy.
Not embryonic, which is the controversial one.
Yes. Okay. And there's also iPSC, induced pluripotent stem cells, when you take an adult, maybe skin or stem cell to the lab, reprogram it to behave like embryonic. So I'm not talking about that or the embryonic. I'm talking about the adult stem cells, whereby you take it from the patient, you give back to the patient the same day. That's the only thing we can do in the US.
I wanted you to clarify that. Where do you take the stem cells from? So it's from the same patient that you take from another part of his body? Explain that. Okay.
For adult stem cells, the word adult is not about age. The adult is because of a matured human being. There are 3 sources. The patient's fat, that's the adipose-derived stem cells. The patient's bone marrow, or from umbilical cord. So umbilical cord, you have to match, do the blood cross-matching between the donor, maybe the mother trying to donate for sickle cell treatment. And if there's compatibility, or maybe to some acceptable percentage, you go ahead and process the umbilical cord to harvest the stem cells. That's supposed to be the the best out of the three. But the logistic, the probability of getting it done is better between families, and then the mothers to get pregnant. So all those stuff makes it kind of also difficult. Currently in US, there's a company which have tried their products whereby they give you umbilical cord stem cell that I can give to anyone, but that's not as good as the fresh, okay? But so now we are left with only two, which is the bone marrow or the fat. The beauty of those two is that you are getting from this patient and you are giving back to the same patient. So the risk of rejection is zero because your own body part. Now, comparing adult and fat, comparing adult fat and adult bone marrow stem cell transplant, it has been found that fat differentiates better, faster for neurological disorders. When you compare the equal volume of both, fat has 500 times more stem cells than bone marrow, and it's easier to harvest and not as invasive as bone marrow. So I use more of fat. Okay,
you earlier mentioned that it's tomorrow's treatment today. Yes. Now, you also mentioned of diabetes and kidney transplants in some patients. Now, does it cut across all major kinds of ailments like cancer? Can it be used for a cancer patient as well? Okay, and
that's a very good question. I know there are people watching this with different kind of issues, and adult stem cell therapy can be used for almost any kind of ailment where there's the regeneration problem, with exception of cancer. Okay. Now, that being said, in animal models, the adult stem cell therapy have been shown to shrink prostate cancer and brain cancer. There was also a study which is on NIH, the US NIH, that adult stem cell therapy was given to a patient with small lung cancer, and all the inflammations, the complications kind of, reduced, and the patient had a better quality of life. But eventually the patient will still die. And then currently, remember we mentioned the induced pluripotent stem cells. They are now programming stem cells to target like things like breast